The Muskegon community, including public health, have been anticipating and expecting the confirmation of the novel coronavirus, COVID-19, in the community. Testing through the Michigan Department of Health and Human Services has identified Muskegon County's first positive case. The patient is an adult female with no history of domestic or international travel. She is isolated at home. She was tested on March 20th, and the results were confirmed yesterday evening. This positive case is a very responsible and cooperative individual. She has given us all of her close contacts within the last 14 days. We have made contact already with those individuals. Our next step is to watch the close contacts in the next 14 days for symptoms and monitor them as well. Have them check their temperature and report to us how they're feeling. At this time, we all need to work together to slow the potential spread of COVID-19. I am grateful, I'm very fortunate that Muskegon County has a group of organizations and agencies that work collaboratively together to help our community and our residents and our businesses combat this serious situation. At this time, I'd like to introduce Gary Allure.
My name is Gary Allure. I have the pleasure of serving as the president for Mercy Health in Muskegon. Mercy Health has been closely monitoring this evolving situation since January and updating our protocols every day in real time as the continues to evolve day to day. We have been and we will continue to be in close contact with our local and state health departments, as well as our parent company, Trinity Health. It's great to have a resource like Trinity Health in a time like this. We have not had any positive cases yet at Mercy Health in Muskegon, but we are prepared. We've got the incident command structure set up in Muskegon and a local command center that's set up at Mercy Health in Muskegon. So we are ready to act when we do have a case. We implore the residents of Muskegon, follow the CDC guidelines and stay home if you are ill, and please practice social distancing. If you suspect you are sick with COVID-19, please contact your medical provider or your local health department. I'm going to now turn it over to Justin Grill, who serves as the Chief Medical Officer for Mercy Health in Muskegon.
Thank you, Gary. As Gary noted, my name is Justin Grill, and I currently have the honor of serving as the Chief Medical Officer for Mercy Health in Muskegon. And from a patient care perspective, I really want to emphasize that we're not requesting you to change anything because we have our first confirmed case in Muskegon County. As Gary noted, our suggestions to our residents is exactly the same, which is if you feel ill, please stay at home, call your primary care physician. If you do not have a primary care physician, if you go on the Mercy Health website, which is mercyhealth.com, and you click on the Learn More button that is under the COVID banner, it will actually take you to a place that shows you a 1-800 number that you can call, and we'll be happy to give advice to any of the residents of Muskegon County. Continue to practice your social distancing, keeping at least 6 feet away from your nearest other person. We're modeling this very well over here. And we ask that you continue to practice good hand hygiene, continuing to wash your hands frequently during the day.
Well, good morning, everyone. And once again, my name is John Severson. I'm the ISD superintendent for the county. And first off, I want to show our support for all our health workers. We recognize what they are facing, and we're behind them 100%. And also a number of essential workers. We have people that are delivering food to many in the county. Last count, this last week, we're over 30,000 breakfasts and lunches to students across the county of Muskegon. And I really believe our county cares. We're connected. Our superintendents in the county and many staff are giving resources. They're reaching out to families and parents, numerous phone calls to do our very best to try to keep some normalcy. As part of that, we're working with the state and many leaders across the state of Michigan, all the way to the governor's office, about the long-term impact facing education. But what I want to say and what I want to be very clear about, this is not a snow day. What they say in the CDC, we have to practice. If you think this is a snow day and a fun day, it is not. And this is very serious. So let's all work together so we can become healthy and ready for school. We as a school community hope the very best for our students in their future. And that is the lens that we're using to get through this. And I know together we will get through this. Thank you.
It is important to rely on reliable sources of information. Visit our website at muskegonhealth.net for continuous updates. We will come to you on a regular basis, if not every day, to keep you updated.